Hello everyone, I'm Samira Ahmed. Welcome to an emergency summit and a press conference on the Prime Minister's announcement to go ahead with plans to lift all legal restrictions from July the 19th. I'm here in a purely personal capacity as an independent broadcaster. I have no affiliation with any of the organisations or individuals represented here. And this summit's been put together to discuss the points that have been discussed in the Prime Minister's briefing, to respond to them and to understand what this means for public health. Today, a coalition of scientists and doctors have issued an emergency statement responding to the decision to move ahead with step 4 of the roadmap. It's the same group who organised a letter to the Lancet last week, which was signed by 122 scientists and doctors, which called the plan, in their words, a dangerous and unethical experiment. More than 1,000 scientists and doctors have now signed that letter. We're going to hear from a few of the speakers to explain why they issued this statement, and then we'll be taking questions. Can I start with Dr. Deepti Gurdasani? Your thoughts first.
I'm actually rather shocked by the statement made by the Prime Minister, supported by the CMO and our Chief Scientific Advisor, Patrick Vallance, today, suggesting that we should proceed with opening up in the middle of what is now a raging pandemic in the UK. In fact, our Prime Minister has told us that we need to expect many, many more cases, many more hospitalizations, and sadly, even many more deaths. And we are being told this is inevitable, and ask the question, if we don't open up now, then when? I think the answer to that is so simple. And I think many, many scientists have said this. We only have 51% of our population now fully vaccinated. Opening up at this point in time, fully acknowledging that a delay in the plan by 4 weeks from stage 3 allowed us to vaccinate many more people, makes absolutely no sense. Completely absent from the discussion today was any mention of long COVID, a long-term illness that we don't even understand yet, that impacts 1 million people in the UK right now, of whom 400,000 people have had disabling symptoms for more than 1 year. Implicit in our plan is that many, many people, many more people, particularly young people, millions more people will get infected. Hundreds of thousands will develop long COVID, and thousands will be hospitalized. And sadly, some of them will even die. We are implicitly accepting that the NHS will come under pressure. We know that current models suggest that we'll have hospitalizations of at least 1,000 per day during the peak of the pandemic. And we're being told that we'll have about 100 to 200 deaths per day at the peak of the pandemic. But we are being told to accept this. And the options we are given is either accept mass infection now with all of its consequences, or we will have a bad winter, both of which are not just false options, but also completely untrue, because we could take the effort to actually vaccinate our young and protect them from mass infection and herd immunity through mass infection, rather than, and all of its impacts on long COVID, when we have safe and effective vaccines available. We could mitigate transmission in schools when we open up in September to prevent having a bad winter. There is so much more we could do that is not been modeled by government at all, but we are being given options that are essentially between the frying pan and the fire, and we are having to choose the frying pan, which makes absolutely no sense to me, when there is so much more we could be doing, and waiting a bit longer would actually allow us to vaccinate many more people and protect them, when now, sadly, many of them will be doomed to essentially developing infection and the long-term impacts of that in many. And what's even more puzzling is that we are being told that this is what the public wants, that the freedoms have to be returned to the public because they're frustrated, when in fact, the data suggests that the public actually want to continue with mask wearing in indoor spaces and want a far more cautious reopening than we're being offered. So one really has to question what the motivation is of acting in not the public interest, when public sentiment is not in favor of what the government is doing, and using a strategy that will definitely put many people at risk and have long-term consequences for the health of many, but also our frontline NHS workers and impact on routine care.
Thank you so much. I'm going to call on Professor Christina Pagel next, but I just want to, for those who might not have seen the Prime Minister's news conference with the Chief Medical Officer, the Chief Scientific Advisor, kind of key message that the Prime Minister gave was that well, this is what he said. The legal requirement is going to end. Sorry, this pandemic is not over. It continues to carry risks. We can't revert instantly to life as it was before COVID. We will stick to our plans to lift legal restrictions and social distancing, but recommend that people wear face coverings in closed spaces, e.g. public transport. And then he also added, for social responsibility, we urge, sorry, the script keeps moving around on me. Where are we? We urge nightclubs to make use of the COVID pass to show evidence of tests or immunity for entry. So that's just some of the context. Professor Pagel, your reaction to the news conference and what was said?
Yeah, I mean, a bit like Deepti, it has left me quite, well, angry, to be honest with you. I think firstly, just on the hospitalizations, the latest SAGE models, which they released just now, I just had a look, estimate that at peak you could have 1,000 to 2,000 admissions a day. And they also say, if the health service comes under strain, you need contingency plans. What are those plans? We've heard convincingly for weeks now that the health service is already under immense strain. Are we really accepting thousands more patients going to hospital? The other thing that struck me was this kind of constant saying it's safer to open now during school holidays. There will be an impact when schools go back in September. After literally 6 months of the government telling us that schools were safe, didn't contribute to transmission, it was sleepovers and all the rest of it. I was like, so finally you're acknowledging that schools make a difference. You want to open up during school holidays and then have no mention, no plan to make schools safer when we go back. I mean, that's crazy. Like, who would do that? Who would say, here is a high-risk situation. Here is a population that I'm not intending to vaccinate, but I'm actually not going to do anything to help make schools safer. The biggest thing they could do is to improve ventilation in schools, right? That's not hard, and it's a public health benefit that will go far beyond COVID. And kind of going on from that, it's quite interesting with the hospitalizations that they stopped saying we've broken the link between hospitalizations and death. They were very clear today that both would go up. What they've done is now saying it's inevitable. It's inevitable. Whatever happens, we have no choice. Unfortunately, this is going to happen. And as Deepti said, we have a choice. You know, this thing about individual responsibility, it's an infectious disease, it's a pandemic, it's collective responsibility, not individual responsibility. And as a society, we can choose to mitigate. We can choose to support our vaccination program with better contact tracing, with support for isolation, with support for businesses, with better ventilation. All of that we can choose to do, and they're not choosing to do it. It's not inevitable. It is a choice. And I don't think we can allow people to frame it as an inevitability when it isn't. And I will stop there.
Thank you so much, Christina. I'm going to call next on Dr. Richard Horton, Chief Editor of The Lancet. Before I do, just to sum up what Professor Chris Whitty, the Chief Medical Officer for England, said at the top of the news conference. He said 98% of new cases are Delta variant. It's a dominant strain now. He said there was no ideal date for lifting restrictions. All models, he said, lead to vaguely similar outcomes. Going slowly is what will make the difference. Dr. Horton.
Thank you very much. It's interesting to see the Prime Minister, the Secretary of State and other ministers desperately trying to roll back on their earlier pronouncements about Freedom Day. But it really was extraordinary to me to watch the Secretary of State for Health in the House of Commons endorsing lifting restrictions at a time of an unconstrained rise in the Delta variant. He is the Secretary of State for Health, and yet he is endorsing this lifting where you're seeing a doubling of the infections every 11 days, hospitalizations going up almost 50% in the past week, COVID-19 dedicated intensive care units being recreated, warnings from NHS providers and the NHS Confederation about pressure on the NHS. This is not, as he said, a measured response. It is not driven by the data. These policies will damage the nation's health, not least because of long COVID. A second point relates to the evenness of the outbreak across the country, which has not been discussed in anywhere near the amount of detail. If you look at the government data, currently England, and this is the coronavirus data provided by the government, has a rate of infection of around 301 cases per 100,000. This is for July the 6th, the latest data that is available this afternoon. But if you look across the country, the rate is very, very different. In the Northeast, it's 706 per 100,000. The Northwest, 434 per 100,000. Yorkshire and Humberside, 389 per 100,000. In particular sub-regions, it's even higher. South Tyneside, 1,308. In North Tyneside, 726. Newcastle, 837. Gateshead, 876. What you are seeing by the lifting of these mandates and allowing this unconstrained pandemic to course through our communities is a rapidly deepening of the existing inequalities that already put people at risk. This government is endorsing a worsening of inequalities. And finally, I found it extraordinary that the Chief Medical Officer suggested and emphasized that there was widespread agreement across the scientific community, whereas in fact there is profound disagreement in the scientific community. He mentioned the letter from the Academy of Medical Royal Colleges. He did not mention the letter that many of you have signed and that we published. And I'm afraid I have to conclude that the Chief Medical Officer is willfully misrepresenting scientific opinion across the country, and that is extraordinary to observe. Thank you.
Thank you so much, Richard. I'm going to go next, Dr. Helen Salisbury, and then we'll take press questions. And just one other bit of information to give. Sajid Javid, the Health Secretary in the Commons, said that because of vaccination, rates of hospitalization, he said, will be a lot lower, and treatments for COVID are a lot better than during the last wave, but he accepted that there would be increased pressure. Over to you, Helen. Oh, unmute, sorry.
Certainly on the ground, I'm in a bit of a plague city at the moment. Oxford is not a place of great deprivation, but it is a place of very high rates of COVID at the moment. And it's very noticeable in the last few weeks, the number of positive notifications that are flooding into our inboxes. Most of them are young people, but not all of them. Most of them are unvaccinated, but certainly a good percentage have had one vaccination, and some have even had two vaccinations and are getting positive notifications. One of my colleagues has been in hospital with COVID despite two vaccinations. These are rare, but they are happening. And I'm particularly worried about people whose immune system doesn't work terribly well. So they may be double jabbed, but that won't necessarily protect them. There are very many people who have an immune system, but for various reasons to do with the treatment that they're receiving doesn't work very well. And it feels a little bit like they're being thrown to the wolves with this, well, wear a mask if you want to kind of attitude. Let's open up. Let's let the virus spread. It seems completely irresponsible to me that we will create a petri dish where we create new mutants and then none of us will be safe. And we're also getting to a stage where those who either are not vaccinated or can't mount a good response to the vaccine are very, very vulnerable. Now, the young who've not been vaccinated, most of them won't do terribly badly if they get COVID. Some of them may get long COVID, which is awful. But the people who are really vulnerable are the older people who cannot mount a response to the virus. This is about, public health, as Prof. Pagel was saying, it's about something we have to do collectively to look after each other. It really doesn't help to say it doesn't matter if the levels are high, if not very many people are going to get ill. I think it's not acceptable. And it's also very clear that no other country in the world has decided, let's go for this option. In other places, in New South Wales, 30 cases, and they go into lockdown again because they want to eradicate the virus. They want to get to the stage where there is zero COVID. And I don't know, I can't understand why we're going in completely the opposite direction. The other thing that I find very, very difficult to understand, there was a headline suggesting that NHS workers should be exempt from having to isolate when they've been in contact with somebody with COVID-19. And this seems to be completely irresponsible. If I'm in contact with someone with COVID-19, despite being double vaccinated, I may well catch it. And I do not want to be the asymptomatic carrier who passes it on to my vulnerable patients. So that there's some very strange thinking going on, and it's so unsafe.
Helen, thank you. I just want to bring in Trish Greenhalgh now. You had a specific point you wanted to make about masks.
Yeah, that's right. I've been listening to and watching on social media the reactions of the public to the announcements, and the thing that some people are most worried about is the removal of the mask mandate, the removal of the physical distancing mandate. It's going to be personal choice. People are saying this is going to reduce my freedom. Either they themselves are vulnerable or a family member is vulnerable. This virus spreads in the air. It floats in the air in enclosed spaces. And one of the particular problem spaces are public transport, because these are quite small in volume. They're often unventilated or underventilated, and there's a lot of people getting on and off. You only need one unmasked person on a tube train breathing in and out. They may not know they're infected. The air in that tube train will be contaminated by that individual. Now, given the airborne nature of this virus, given that all you need is one irresponsible person, and given that the public are saying this is reducing my freedom, it's not increasing it, I think we need to uncouple the idea of getting back to normal from the idea of leaving off our masks, because actually public masking in indoor spaces for a few more weeks until the virus is better contained would actually help to open up. It could be a symbol of freedom rather than a symbol of muzzling and oppression.
Thank you. I want to get a question from Graham Lawton at New Scientist. If you'd like to ask your question, if you want to unmute, and you can turn on your camera if you'd like.
No question for me today, thanks.
Oh, okay, sorry, I thought you had one ready. In which case, I'm going to ask Gabriel Scally, I know you wanted to come in at this point.
Well, I just wanted to point one area where there appears not to be much, if any, scientific dissent, and that is that we need better prevention measures in general. And the complete failure of the government, and I speak as a public health doctor, the complete failure of the government to take basic public health preventative steps is absolutely atrocious, and it was reinforced for me today. Again, there is no scientific dissent about the needs for ventilation. All we had today was a throwaway remark from Patrick Vallance to, what did he say? He said, make sure ventilation gets a priority. Well, the government has done nothing to give ventilation a priority, and it's hard to see who they expect to do that if they won't give a lead on it. And he talked about opening windows. Opening windows isn't good enough. It needs to be active ventilation. Spain and Belgium have taken steps to put in monitoring in certain buildings, monitoring of displays of CO2. There is a real need for us to do things about ventilation that the government has willfully ignored, and they're willfully, I would argue, ignoring the law on this matter, because there is a legal requirement for workers to be provided with fresh air, and the definition of fresh air has certainly been changed by COVID-19, and we need enforcement of a new definition and the ventilation to make sure that the air is pure. And the same issues about test and trace was mentioned, but we know it's a failed test and trace system. It's not a proper find, test, trace, isolate and support system. From the very beginning, England has been well outside the international advice on testing high-risk people for reasons I cannot begin to understand. We don't test in England people who are close contacts of someone who has tested positive, despite that being the advice of ECDC, CDC in Atlanta, and WHO. They are the people at highest risk. We tell them to isolate and to come forward testing if they become symptomatic. This is completely wrong. They are not doing the preventive actions. And with mask wearing, I think the time has passed when 3-layer face coverings are satisfactory. That was for an era when we thought of droplet spread. We now know it's aerosol spread, and we should be upgrading, as many European countries have done. The norm should be FFP2 masks or a better quality of mask rather than face coverings. So the basic fundamental public health actions are being yet again ignored by the government.
The Prime Minister says the 4 tests have been met, though.
Well, I can't understand how he says that. The fundamental test is the government protecting the health of the population? And we're seeing a surge in cases and no adequate response to that surge, and no adequate public health measures.
Okay, I want to just take Professor John Drury, and then I'm going to take a question from John Hebden at Radio Bradford. I'm really interested in what you think will be the public interpretation to the message that's come out, which is you should keep masking, you should keep social distancing, but it's not legally required anymore.
Yeah, well, in a context where other protective behaviours are legally required, and in a context where masks have been legally required, to drop that legal enforcement sends a very strong signal. Now, we got a very strong signal going in the opposite direction last year, because if you remember in the summer, people were wearing masks before it was legally required. When it became legally required, the numbers adhering massively shot up, because it sends a very strong signal that it's important. And it's also quite unambiguous. I mean, the alternative they're proposing is that it becomes advisory that people wear masks in certain places. Now, at the very least, what they should be doing is some kind of public engagement activity, but there isn't. Where's the communication? Where's the dialogue? Where's the education? So do people know that they work, how they work, that they protect others? These messages are not really getting across. So we hear a lot now about personal responsibility, but one of the SPI-B documents published just over a week ago also acknowledged personal responsibility is important. It's always been important, but it needs to be balanced with providing capacity, which means educating people on risk. How can people exercise personal responsibility if they don't have the information?
Thanks so much. Right, BCB Radio Bradford, John Hebden, you've got a question. If you want to turn on your camera and go for it, and your mic. Hi.
Thank you, Samira. Hi, everybody. So given that legal restrictions on face coverings and distancing will end next Monday, this will create a situation in which I think many older and clinically vulnerable people will feel that they can no longer use public transport or go shopping safely. So I wondered if people thought this was worthy of a challenge under equality law, given that the changes will be placing restrictions on people, on older and disabled people in particular.
Thank you. Who wants to take that? Zubaida.
I think that's an excellent point to raise, John, because I mean, this is exactly the nub of the problem, isn't it? That when the Prime Minister says that July the 19th will be Freedom Day, it will only be Freedom Day for some, but for many people out there, including the clinically extremely vulnerable, including the children and the carers of clinically extremely vulnerable people. There are many people out there like them who won't have that freedom and who really will be imprisoned more than anything else. Their freedoms will be substantially restricted. And I think it's a very good question to ask, were any equality impact assessments carried out on the impact of opening up, on the impact of abandoning all public health measures or all legal restrictions around public health measures on disabled groups? And I'm pretty sure there isn't, because at the moment, all we're hearing from the Prime Minister in terms of the response to clinically extremely vulnerable groups and their carers is, well, perhaps you might want to shield a bit more. But how can they shield if they've got carers who are unvaccinated? How can they shield if their children are not in the vulnerable or clinically extremely vulnerable group? And is it fair? Is it appropriate and right, ethically right, for those people after 3 lockdowns to have to shield even more because the Prime Minister is refusing to use any of the measures, any of the tools that he has, which is vaccinating the rest of the 48% of the population, vaccinating young people, which is using test, trace, isolate, which is ventilating schools while they're going to be closed over the summer. Because the Prime Minister is refusing to use those public health tools, vulnerable and extremely vulnerable groups, even those that are at risk in any which way or form, are now going to have to be forced to be imprisoned, really. They're going to have to shield against their best wishes. There was no engagement about the Prime Minister's mass infection strategy.
Thank you, Zubaida. Christina, Pagel, I know you want to come in. If anyone else on the panel wants to comment on this, do just direct message me.
Yeah, I mean, I think thinking about it from an equalities law angle is really interesting, and because it affects not just the extremely clinically vulnerable, but it also affects ethnic minorities and more disadvantaged communities who we know are already more exposed to catching COVID through living conditions and working conditions. We know that they have lower rates of vaccination for a variety of reasons, including access. And we know that they're more vulnerable to getting long COVID. We know that from the recent Imperial study. Currently, for the first doses for over 18s in England, over 81% of white adults have had a first dose compared to only 50% of Black adults. So what are you doing by opening up and allowing infections to rip through communities? You're allowing them to rip through disadvantaged and ethnic minority communities disproportionately. And so what are the kind of equality law impacts of that is the question that I would ask.
Thank you. I want to just hear from Professor McKee and then Professor Katzourakis, and then we're going to take the public questions that have been submitted, which are great. Professor Martin McKee, this whole if not now, then when narrative from the Prime Minister and the Health Secretary, that there is no better time, all the models suggest it might as well be now. Could you respond to that?
Yeah, I'm particularly concerned about whether we really have met the 4 tests, because as I look at it, there are certainly some questions. I'm not disputing what was said, but I just feel that more could have been said. It would have been helpful if it had been. So the first test is the vaccine deployment is proceeding, and as Christina has pointed out, it's not proceeding anything like as fast as it should do among minority ethnic populations, but actually the rate of uptake has fallen quite dramatically. I was just looking at the figures on the 4th of June. The 7-day moving average of people getting their second dose was 356,000, and it's now on the 7th of July down to 164,000. Obviously, the vaccines are very good at reducing hospitalizations and death, but we haven't broken the link by any stretch of the imagination between cases and hospitalizations. In the last week, cases went up by about 30% and hospitalizations went up by 40%. And there's still the same correlation between hospitalizations and cases as there was last year. And I'm also puzzled about the variant of concern, because the roadmap was originally published on the 22nd of February. But the Delta variant only became a variant of concern on the 7th of May. So during the course of the roadmap, we actually have had a variant of concern coming in, which has changed things. So there are also obviously questions about going forward. I think Christina and others have picked them up about whether it is inevitable that we will have a peak later in the year. That seems to presuppose that we won't bring in many of the mitigations that we know. But it just seems to me that given that we know that the vaccines are effective and are important, if we have a little bit more time to get more people vaccinated, that can only be a good thing. The other thing that worries me about doing it in this way is that I'm not entirely sure what the message is. And other people have said this too. I'm really confused because I've listened to the Prime Minister at various occasions over the last few days, and to the Health Secretary and to the Vaccines Minister. And in a way, we were being told it was Freedom Day, everything was to open up, we should go and enjoy ourselves. I mean, it was a little bit like getting to the end of the Second World War and VE Day and go out and celebrate in the streets. That's fine. That was the impression that I was getting. And now the impression seems to be rather very, very different. Well, You don't have to isolate, but you should isolate if you're a contact. You don't have to wear a mask, but you should do if you're in a crowded space. And you shouldn't even go into a crowded space, but you can do if you want. So with all of this, is this really the right time when I'm not convinced that we've really met the 4 tests, and when we don't have a clear set of recommendations for what people would do? We haven't actually got our message clear yet.
Thank you so much. Professor Aris Katzourakis, I wanted to ask you about variants. So new variants we heard may emerge, but they will be dealt with through rapid surveillance. What do you think about the government's current strategy, and what is the risk of new variants emerging?
Yeah, I mean, some of the biggest threats in this pandemic, after, of course, the initial introduction of the virus into humans, have come through the emergence of variants, in particular the Alpha and the Delta variants, and these were a result of virus evolution. When people think about evolution, it's very easy to think of it as a force of nature, as something that happens that's external and doesn't depend on our actions. Unfortunately, the public health measures that we take have direct evolutionary consequences, and we saw this both with the Alpha and the Delta variant. The Alpha really sort of came to dominate and was facilitated by the relaxation in December 2020, while the Delta variant was imported in very great numbers due to a failure of having an appropriate border control policy. Now, the situation we find ourselves now is one where we're basically relaxing our guards to the risk of further viral evolution, and we're allowing potentially uncontrolled viral spread in a partially vaccinated population. Now, I can't tell you exactly when and whether and how strong a viral vaccine escape variant might be, but in terms of maximizing the risk of that happening, allowing uncontrolled viral spread at this particular point in our vaccination program is probably the most risky point in time to do it. If we allow the vaccination program to complete, to fully vaccinate the overwhelming majority of our population, we're going to greatly mitigate the risk of the possibility of an escape variant that could threaten our program, both here locally, but also on a global level.
You just said this is the most risky time to be doing what they're doing.
It's a much, much more risky time to be doing this than after the majority of our population has received both of their doses, because we've already seen that the Delta variants can escape one dose of the vaccine to a reasonably good extent. It's got much less escape after 2 doses, but not everyone has had 2 doses. And there is still a small amount of escape from transmission with 2 doses. So we're still in a situation that could help the virus along, that could facilitate further steps in its evolution, and we'll be in a much, much safer place after the majority of the population has completed their vaccination schedule.
Thank you so much, Aris. Right, I'm going to start taking some of the questions that have been submitted from the public, some of which are nice and simple questions, but I think they're all issues that a lot of people have on their mind. So this is one that came from Rebecca Payne. I have a question which is plaguing many parents of clinically vulnerable kids. Should my unvaccinated, clinically extremely vulnerable child be going to school? Who would like to take that? Yeah, Zubaida, do you want to go first?
I think the difficulty is parents should not have been put in that position. I mean, what a position, what an awful and appalling position to put parents in, where they have children that they have tried desperately to protect throughout this pandemic. And yet what the government did after May the 17th is lift face masks in secondary schools, and very little about mass testing or anything. They did absolutely nothing. They did nothing about testing. So right now we have a situation in schools where there is very little protection. It's very difficult to know what to say to this parent, because the reality is schools right now have very, very, very high rates of infection. We know that the highest rates of infection are among young people, especially in the 10 to 30-year-old and 10 to 19-year-old group. So it's very difficult to know, because the reality is what mitigation measures are there in those schools? I think the long-term question is, as my colleague Christina rightly pointed out, is this isn't going to go away. This is going to get worse before it gets better. So Zubaida, the Health Secretary, has already told us that we will be looking at over 100,000 cases per day by the end of this month. So what happens to children at the beginning of September if absolutely nothing is done? So it's a real difficult dilemma. Hopefully your school will work with you. Hopefully they'll be doing lots of activities outdoors more than indoors right now, because that would be the safer thing to do. And hopefully schools, given the context that we're in right now, will be saying, and local authorities will be saying, that face masks for school children, secondary school children in particular, should come back.
Thank you. Deepti, I know you wanted to come in on this. Anyone else wants to come in on it, could you direct message me? Deepti, go ahead.
So clinically vulnerable children have been hung out to dry. They are susceptible not just to long COVID, but also severe disease. And currently they have to attend school, mandatory attendance, where no one is wearing face masks. There are 30 children crowded into classrooms. There's no ventilation, there's no social distancing, and they haven't been offered vaccines, which have been offered to adolescents in most other countries. So it's a really, really precarious situation for them. And obviously, parents are very anxious. And when the government talks about, it's better to do this now rather than later, what they're essentially saying is, I mean, this is based on the imperial model, which this is based on, is that essentially millions of children getting infected over the summer and developing infection-acquired immunity is going to essentially then protect adults in the winter, because we may not see the surges linked to school openings, which would then affect vulnerable adults who at that point in time will have immunity waning from vaccination, because vaccine-acquired immunity will also wane over a period of time. And that's a calculation that has been made. Implicit in the calculation is that children get infected, develop immunity, and that's why outcomes are better for winter, because otherwise it would make no difference. And it's completely reckless to expose children to this infection when we could be vaccinating them, but even more so for clinically vulnerable children who can develop very severe disease and have absolutely no way to protect themselves in these classrooms. The only thing they can do is not attend school. And we've created this sort of situation in the name of personal responsibility, where children can do nothing to protect themselves apart from get out of education and be deregistered. And that's what a lot of parents have done over this pandemic. They've had to deregister their children because there is absolutely no way to keep them safe, because our government will not put in measures to keep them safe and will not vaccinate them.
Okay, I want to take a question that's come in via Twitter. Why aren't there stronger alliances being formed here? Why aren't the Royal Colleges coming out strongly against this? The head of the NHS Confederation. Teaching unions have made some noise, but it's missing. What's missing is a more coordinated opposition. Who would like to comment on this? Richard Horton, maybe?
Well, it's a fair point. I think all of those organisations that you've mentioned have come out and raised concerns at slightly varying levels of sharpness. But it's true that there hasn't been a coordinated effort, apart from the letter that you all put together. Actually, that's been the most coordinated opposition. I think also there's a little bit of reticence because we do all know that the sharper the public debate amongst scientists, the more confused the public can get, and that can have damaging consequences. So that may be one reason why people have pulled their punches a little bit and are anxious not to get themselves into direct opposition with the chief medical officer and the chief scientific advisor. But I think the stakes are so high now at this particular juncture that I'm afraid that cautious approach, it's time to stop that.
Thank you. Question from a member of the public watching live on YouTube. When will it be known if recent activities such as university students going home and Euro 2020 were super spreader events, if they have significantly accelerated infection, do you think the Prime Minister will U-turn as he has done in the past? And when do you think that might happen? Christina, Pagel.
So it's very difficult to say for sure that this particular thing caused this change in infection, but we should see the impact of the Euros over the next 10 days. I find it very hard to believe that it hasn't led to some super spreader events. I mean, you just had to look at the scenes in pubs around the country and in homes, I'm sure, where everyone was shouting, me included, I have to say, but not in a public space. But, we know from Public Health Scotland, from the Scotland-England match, that they linked 2,000 infections to the Euros, to the football. They saw a significant difference between infections in young men to young women. The recent Imperial React study, which tests a random proportion of the English population, also found significantly for the first time that young men were more infected than young women. So it is likely that there is a football effect that we're already seeing, and Public Health England collects data on gender and age, so they would be able to check that. Whether it will create a U-turn, I don't think it will, because I mean, to be honest, the idea that you would open up further right now means to me that you must have such a completely, basically the government has decided that infections don't matter. And if that's your position, why would you ever U-turn on anything? And we fundamentally disagree. We think infections matter and we think they're avoidable. And if you hold that position, then you're in a completely different universe of policy.
Zubaida and then Helen Salisbury.
Oh, Helen can go before me.
Helen, go ahead. Thank you, Zubaida.
I just wanted to follow on from Prof. Pagel that it does seem that the statement that now is the time to open up, and they seem to be actually wanting lots of people to get the infection, to have this, and we seem to be back to herd immunity. So I don't see that there being a huge rise in cases is going to change any of the strategy, because it does seem to be that that's what's intended, that they're hoping there will be some natural immunity, which most of us don't think is such a good idea. I think the thing that might make them change their minds is when that, because there are so many, that the hospitals start filling up. The temporary COVID ITUs have to be recreated again, and the patients or the older people in care homes who have had 2 vaccines, but those vaccinations, the effect of those vaccinations are waning, or some of them, it's not 100%. So I'm worried that at some stage that this huge spike in infections, which looks like it's going to carry on climbing, will translate into hospitalizations and into deaths. And at that point, the government may need to make a U-turn. But I can't see that they've got the imagination to do that before then.
Before I bring in Zubaida, Helen, can I just add something you've just mentioned? Links to a question put in by Lee Bailey. Is there any firm data to suggest when the efficiency of the vaccines reduced? My biggest concern is that those of us considered clinically extremely vulnerable were first in line for vaccines, thankfully. And I believe a large number of us received AstraZeneca. My understanding is that AstraZeneca is already showing to be the weaker of those available, and will be the first to find out whether it remains effective for us or not.
I think we don't know, at least I don't know, other people on the panel might, about how long the immunity lasts. We know that we've been asked to stand up for a booster campaign starting at the beginning of September. So we're going to be expecting to revaccinate the first cohorts that we vaccinated originally in December and January last year. We're going to be doing that again in September. So there is an assumption that we're going to need more.
Okay. I'll bring in Zubaida, and then if there's more to be said about vaccines, we'll come back to the rest of the panel. Zubaida.
Well, just very quickly, first of all, I want to say thank you, Helen, because you made the point, one of the points that I was going to make, which is that we need to highlight exactly what the government are not saying here, but what is happening, which is that this is a mass infection experiment. It's not a strategy as much as an experiment. They are experimenting to see what happens when you let the virus go rampant with 48% of the population who are either partially vaccinated or not vaccinated at all. And in particular, among young people. Young people here are the guinea pigs. And the second point I wanted to make here is that the government have talked so much about vulnerable people. They put emphasis on the fact that vulnerable people were vaccinated. But when it comes to vulnerable children, there's a deafening silence, as though there are no such thing as vulnerable children out there. And yet we know that children have diabetes. We know that children have asthma. We know that children have all sorts of underlying illnesses. Adult illnesses don't come out of the vacuum. I mean, they start, a lot of it starts from when they were children. We know that children are extremely vulnerable, and yet there is absolutely nothing being said or done about children being vaccinated or protecting them.
Thank you. I want to bring in a question from Michelle, who's a live audience member, and you've got a question about long COVID. Would you like to turn on your mic and your camera? Hello, Michelle.
Hi, thank you very much. Yeah, so 15 months with long COVID, unfortunately. I am now able to work, but that's about it. And so it's, I guess this has become not quite a hobby horse, but certainly something of great interest to me. Luckily, I've been able to keep my daughter safe, but you know, it's I think by luck more than anything else. And I noticed tonight that both the PM and the CMO were saying that there's no optimal time to open up, but surely the start of a new wave is a suboptimal time to open up. And I'd like to better understand the logic that CMO was using with the modelling that he mentioned. Has this modelling been published, and can anyone on the panel speak to it?
Thank you, Michelle, so much for that. Who might be able to help on this? I know that the news conference happened quite a short time ago, but that was a very key point that the Chief Medical Officer made. Deepti. Unmute, sorry. Thank you.
So I haven't had time to go through the most recent models, but I mean, this was a statement that was being made even last week, which refer to the imperial models. And essentially what the models do is compare two bad options. So they compare opening up now versus opening up in winter at a point in time where immunity is waning and opening of schools may lead to another surge. They don't consider long COVID as an outcome at all. They only consider death as an outcome. And when you compare those two models, then it appears that if you let millions of children get infected now and get naturally acquired immunity, that it might prevent that surge when schools reopen, leading to more infections in the clinically vulnerable. One thing that the imperial model document says that we've never been told by a CMO or prime minister is that it doesn't account for the fact that children could be vaccinated and boosters could be given to those who are clinically vulnerable and mitigations could be put in place in schools, all of which completely change the equation. So of course, if you compare two really, really bad options and you don't consider the huge impact of infections on long COVID and you only look at deaths, then it may look like infecting millions of children now for them to develop immunity to protect our vulnerable over winter is a good idea, when in reality, it's completely reckless and unethical. If you consider long COVID, and if you think that you can actually mitigate in schools, you can actually vaccinate children rather than exposing them to mass infection and protect our clinically vulnerable in winter by giving them booster vaccinations, then all of that disappears because you're no longer in this false dichotomy of two bad options that have been created for us.
Thank you. And Michelle, can I just say, we're so glad to hear that you've had enough of a recovery that you're able to work, but I'm sorry, I can't imagine what it must be like to have had 15 months of it. So all the best to you. Would anyone else like to respond on this? Christina, I can see. And if there's anyone that I'm missing who's on my other screen, do direct message me. Go ahead.
Yeah, so just two things. On long COVID, I feel as if it's just, because it's not routinely measured, because it's not updated on the government dashboard every day and not in the public health weekly reports, it's like it doesn't factor into decision making. It's not an output of any of the models, and so it's been ignored when it's a massive issue and we shouldn't be ignoring it. We shouldn't be ignoring it at all. And so we've been trying to raise it a lot. A lot of people are. So that's just kind of one thing that I wanted to say there. And just on the modelling, and just on the kind of the two bad options that Deepti discussed and this kind of idea that somehow it's inevitable, I just want to raise that Israel did not have an exit wave, right? They did not release their public health restrictions until they had vaccinated a huge proportion of their adults. And they kept in masks and mitigations in schools for months after they got COVID really low. And then they released them and they kept COVID really, really low. There was no exit wave that is meant to be this inevitable. Israel is now seeing a resurgence in infections because, unfortunately, despite their strict border controls, they imported Delta. And we know that Delta is more transmissible. So they're now seeing it go through again, their children and young people, but also some vaccinated people. What's Israel's response? They're imposing new restrictions, bringing the masks back, putting in more social distancing, strengthening their border controls to try and get it back under control. So it's not this idea that the only way to open up after vaccination is a big wave. It's just completely wrong. And the only country that's done it, which is Israel, have shown that it's completely wrong. So I just wanted to put that out there as well.
One thing I just wanted to add, and then I want to take two more questions that have come in from the public, is people may have seen the images from Heathrow Airport today of Terminal 5 absolutely packed because 100 border officials are self-isolating. And I just wonder what the panel's thoughts are about the whole issue of the border controls and their role in managing the situation going forward, given that it's a big factor in the Delta variant having got in. Gabriel Scally first, then Martin McKee.
Well, it is quite remarkable that the UK, that Britain and indeed Ireland have reacted so poorly in terms of controlling the influx of the virus right from the very beginning. It's as if Britain forgot it was an island and hasn't looked at experience abroad. And that, Christina's example of Israel is just one example of many of the places across the world that the UK has failed to learn from. And indeed, we know from actually a paper presented to the official SAGE committee from one of the subcommittees that there was advice that too much discussion of preventive measures successfully operated in other places might unsettle the public if the UK wasn't doing them. And there is this fantastic temptation to ignore what's going on elsewhere. And I think the UK is in a really exceptional situation at the moment, where having this huge, compared to our neighbouring countries in Europe, a huge wave of cases. And we are talking about reducing border controls, as if somehow we're going to get people coming in and making it worse than it is here. Well, we might do if we bring in extra variants. But I'm just amazed that the UK hasn't been further isolated. And what the government is playing out to is that the UK will become a pariah in terms of COVID and a dangerous variant and be shut down by other countries. And, as someone said at the beginning, how little notion, a little attention had been paid. Oh, it was Richard who said about the letter in the Lancet, of which I was a signatory. I do confess to that. Before I say that letter has had a really substantial effect, but not in the UK. Micheál Martin today, the Irish Taoiseach, described the situation in the UK as a free-for-all. And the letter, Lancet letter, was directly quoted by the two senior officials in the Health Service Executive in the Republic, and they quoted it as something they supported in terms of taking a very precautionary approach to the spread of Delta. So it is a strange, isolated situation that we are in, from sense and sensibility from the rest of the world, and our failure, complete failure. It is the absolute bankruptcy of our border controls on public health grounds. It's one of the great scandals of this pandemic.
Martin McKee.
Yeah, the letter's also been covered quite extensively in the media in continental Europe, El País, German television, and elsewhere. I think my difficulty with this is, like with so much of it, it's really quite confusing. So after the July the 19th, as I understand it, somebody who is 17 years of age, 11 months and 28 days will be able to come back without quarantining. but regardless of their vaccination status, but somebody who is just over 18 will have to be double vaccinated. And it's these issues around the border. At the Euros, we had several thousand VIPs who were able to come in for the Euros finals without having to undergo quarantine. And just trying to make sense of this, it's almost as if the virus is expected to know who it is infecting and behave appropriately given that information. And I don't think the virus is that clever. It may be pretty clever, but I don't think it knows all of that information. So that's where my problem arises, in that I'm trying to work out what the logic for all of these decisions is, and I really struggle with it.
Thank you so much. There's one final question that I think is worth asking. It's coming via Twitter. Your statement, the group statement, refers to an apparent herd immunity strategy by mass infection. It's something that's been discussed in passing throughout this news conference. But the person is asking, why is no one really talking about this? And I suppose to some extent we want to know what does that really mean for the public out there who are watching this and wondering. Who wants to go for that? Christina Pagel.
I mean, the government says it isn't, but at the same time, they've said they're very happy to have, they're willing to live with potentially a few more million infections just before autumn. In terms of a herd immunity strategy, I mean, in a sense, that's the strategy for the whole world. Ultimately, the pandemic ends when the world is at some kind of herd immunity. The question is, how do you get that immunity? And you get that immunity either through infection or through vaccination. And so far, the strategy of the UK government has been, we're going to get there by vaccination. And it's done pretty well. You know, we're 52% fully vaccinated. We're doing really well with getting adults vaccinated. And what it's decided now is we're not going to wait to finish that. We're now going to supplement it by letting lots of other people just get immunity by infection. And there's increasing evidence that immunity from infection is actually less robust than immunity from vaccination, particularly to new variants, and that it can wane quicker. So it's not even as good as a vaccination. And also it's just so much more unpredictable, right? You know when you're going to get vaccinated. If you're not getting vaccinated, then you're just going to have to wait and see when you get infected from an individual point of view. So I don't know why people aren't talking about it more, but it's pretty clear to me that that's what the decision is, that they're going to mix it in, they're going to keep vaccinating, but in the meantime, if they can top it up by lots of people getting infected, then so be it.
I'm going to bring in Richard and then Gabriel. Richard Horton, am I right thinking you haven't signed this statement, but your thoughts on this idea of herd immunity?
No, we published it, so it didn't seem very appropriate for me to sign it and publish it.
Just to clarify that, it's useful.
At the same time. No, I think this is what Christina said is exactly right. The government has decided that it's going to go for an unconstrained outbreak of Delta across the population to build up that population immunity. And I think that you've seen a change in the balance of opinion within the ministers who are making decisions. The new Secretary of State for Health, Sajid Javid, is more libertarian than Matt Hancock was. I think Matt Hancock, despite what one might have thought of some of his decisions, was more cautious. And that caution has now been dismissed from government decision-making. But what surprises me, and I'm sorry to come back to this again, is I'm just very shocked that the government's medical and scientific advisors are not being more public about their concerns. There are hints, there are clues, there are elisions in their language, but
yes, they sometimes talk about it being it's a political decision, not a medical.
And you're left to pick up some of the clues in their language about what they feel, but their primary responsibility is to represent the public to government in terms of the best medical and scientific advice. And it feels to me that they are simply acting as cover. And it was very clear in the press conference today. The faux deference that you saw from both of them to the Prime Minister in trying to shore up his decision-making, I thought was an abdication of their independent role as government advisors.
Thank you, Richard. Gabriel, and then I'm going to bring in Deepti and Helen. Gabriel.
Right from the very beginning, the government has had this idea of herd immunity as a way out of this pandemic. They talked about it openly for a few days at the beginning of the pandemic, but it's still been there in the background. There can be no other strategy that they have. In fact, one of the big failings is they don't have a strategy, but in as much as they have any, it is certainly to build up population immunity through infection. Why else would you not use the approved vaccine for young people from 12 to 18? Why else would you think that it is a good idea to go now, as the chief medical officer said, in terms of reducing the restrictions and letting the infection spread and cause hospitalization and some deaths now, because they think it's better than in the autumn. So herd immunity is definitely what they're trying to do. They will fail in this because they do not understand herd immunity. The whole herd immunity concept was developed 100 odd years ago in laboratory mice. That's when the experiments were done. This is not a homogeneous population like laboratory mice. We have already, and someone mentioned it, I think it was Aris maybe mentioned, the tremendous variation that there is in the uptake of vaccines in different groups, in different communities. And we also will have borders open and people moving and traveling. And most importantly, we do not have a public health system that is capable of keeping us safe from COVID-19. For goodness sake, the UK lost its elimination, its herd immunity effect for measles in 2016. And our health system is not capable of keeping this virus under control. By simply herd immunity alone, it is not a feasible strategy, but I agree it's a government strategy. And like all of their other strategies about handling this pandemic, it is doomed to failure.
Deepti and Helen, if you keep your comments relatively concise just because of time. Thank you.
So I think people are nervous about using the term herd immunity through infection because they feel unsure about intentionality of the government. But if it looks like a duck and walks like a duck, it is a duck. And they are going for a herd immunity strategy. It's very, very clear from their modeling. And one of the reasons I think so is because they've steadily removed mitigations, for example, in schools, in the middle of a surging pandemic. And now they seem to be moving any signs that they're going for a herd immunity strategy or signs that things are not going well. So we've heard ministers talk about stopping reporting cases because this will make people anxious. We're hearing that under 18s contacts of cases will stop isolating. Healthcare workers who contacts of cases will stop isolating. So we will no longer see educational disruption. We will no longer see cases because all the symbols of spread are gone while we are having an unmitigated pandemic. And that is essentially what herd immunity is, through infection, letting it spread across millions of people in the hope that they will develop a level of immunity because we are not willing to vaccinate them.
Thank you. And Helen, in your thoughts, can I also tag something on for you, which is, it's a question that came in from Patty Crompton in Tewkesbury, and I wanted to ask it, which is, why do you think the rate of vaccination take-up has dropped so dramatically? I don't know if you can answer that.
So I think one of the reasons why vaccinations have fallen is that GP surgeries are no longer able to do them because we all got too busy looking after the other work. So up until June, with the older patients, the over 50s, 75% of those were done in GP surgeries, and we were really good at recalling our patients. We knew who they all were. We contacted them. If they didn't come, we contacted them again. We really went for it. It's not worked. It's not been the same coming centrally, which is how the younger cohorts have been done. So I think that's been one factor. And just on the question of herd immunity, of course, for anyone who doesn't quite get it, is when enough people can't get the disease, that if it arises in one place, it can't spread anywhere else because there's no people vulnerable to catch it and pass it on. And there's two ways you can do that. You can do it because most people, 85% or whatever the fraction is, have been vaccinated, or you can do it by that number of people having had the disease and not being able to be infected again. The difference between herd immunity by vaccination and herd immunity by infection is if you do it by infection, loads of people get ill and lots of people get really ill and stay really ill. If you do it by vaccination, you're in control, you don't pass it on, and everybody stays well. I cannot understand why the government would opt to do herd immunity via infection when they could do herd immunity by vaccination. I think it's criminal.
Thank you all so much. It's been really important and I think helpful, if admittedly also quite scary, I think I can use that word, to hear your analysis of what's been announced by the Prime Minister and the Chief Medical Officer this evening. Just to mention before we close that the Society of UK Theatres and London Theatres have just announced that they are going to keep masks and one-way systems and social distancing. So it does look like individual organisations are having to respond by coming up with their own agreed protocols, but it's industry by industry, and I suspect we'll see more of that. Thank you again so much for all your time. Thanks for all your questions. If you want to go and see the original statement and read some more, it's on the All the Citizens Twitter page. That's @AllTheCitizens, so you can find out more there. And thank you again to everybody, and take care of yourselves.